Okay, welcome to, is it our third? I feel like we've been doing this all week. It's our third webinar for AI in different sectors, and today we're doing healthcare. Thank you very much for joining us this morning. Very, very excited. I genuinely are, and I think you'll see some of my team nod. I'm genuinely very excited to show you some demos here today. The nature of AI, I'm sure, will make it interesting. So we're going to go through a bit of background on Agentspace. It's one of the AI tools that we are really driving at the moment. Lots of uptake on Google. So we have Jan here who's going to present that, and then Kais. But let's just skip into the intro, shall we? So Jan, can you please introduce yourselves for us?
Yeah, sure, Matt. So I'm Jan. I'm responsible for healthcare in Belgium, which means mainly all hospitals in both regions, all the three regions of Belgium, and also healthcare institutions, healthcare startups that are working specifically with our healthcare people.
Amazing, thank you very much. And myself, I'm here, based in the UK. I'm head of AI and innovation in UK. Actually, I had a new hat recently, the head of technical here. And across EMEA, I manage the customer success services over all our customers in EMEA as an escalation point. And today I'm going to talk to you about some of the stuff we've done with our customers and potential customers. Kais, go ahead.
Hi everyone, I'm Kais. I'm the head of machine learning here in Belgium for the WTMG Cloud. And what I will do a little bit later towards the end of the session is to try and convince you that we can build some nice custom agent with agent development kit.
Good. Excellent, thank you very much, Kais. So without further ado, Jan's going to give us a quick 15 minutes over the Google slide of the products, and I'll skip over the agenda and I'll head straight over to that, if that's all right, Jan. You should have control of the slides as well.
Okay. Okay. So hi, pleased to meet you. Thank you for the invite. Always happy to help and to continue pursuing healthcare in Belgium. So first of all, what we see is a lot of challenges currently in our healthcare landscape. So a lot of things are changing. It's rapidly evolving. And we see a lot of hospitals struggling with a lot of innovation. First of all, there's of course the lack of money. We don't have enough spending anymore from federal governments, so that puts a lot of pressure on healthcare systems to find money where they can and to make alterations to still give the best care as possible. And another big challenge, for instance, is labor. So we have now clinicians who no longer want to work like the old days. That's how they tell me, from 8 in the morning till 8 in the evening. Physicians are now more aware of their work-life balance and want to pursue that kind of living further on. Also, the specialities are very, very much narrowing, so it's really hard to find specific specialists for one specific topic. It also creates a lot of pressure there. And then on the nurses, there's not enough influx from nurses, for instance. They're overworked with a lot of administrative tasks. And they're not, they're spending more time behind the computer instead of next to a patient. It creates, of course, a lot of overload where some nurses go into burnouts, which creates a lot of more pressure on the current nurses. And it's a vicious circle that continues. So those are big challenges for our current hospitals. And then on top of that, there's of course other things that are playing. There's huge amounts of data, and a lot of data is locked into different silos. And administrators know there is a lot of potential there, but since it's not a lot of different silos, it's really hard to get access to that data. Secondly, there's cybersecurity. It's never been more important. Every week we see attacks on hospitals in Europe. So ransomware requires a really focused view on their security way of going with things. Another thing is how do you share data, data interoperability. There's so many different silos, so many different systems. We now have doctors, if they want to have one view of their patient, they have to go in so many different systems, log in, find the name, do a search, etc. It takes so much time. And there's a huge influx from other data. There's wearable devices like Fitbit and Pixel Watch, which now support the Fire data, but also medical devices. They are tending to use it more to keep patients at home, so they don't pressure the current hospital, but they can do monitoring, remote monitoring. But that creates a lot of data. How do we handle that data securely with respect for privacy, etc.? And then once you have all that data, what do we do with it? We still have legacy systems. I have hospitals who still have access databases running on a laptop, which is in production. So there's so much legacy systems that are still working, but how do you access all that data to transform the customer? Yeah, this is a picture that most physicians will clearly know. In one hospital, you have so many different data stores, patient and health data. Of course, the electronic healthcare systems are known. Years ago, we had a lot of technology that didn't work well. Now we have a lot of technology that works amazingly, but doesn't work together. And that's a big problem at the moment. Now, what do we do with all those data sources? We have to support, of course, the de-identification of data, to do downstream analytics. Privacy of the patient is really important. Where do we store that? So here, Google supports the FHIR standard. FHIR is the well-known standard adopted by hospitals worldwide. So it creates a uniform data model. And we also have to normalize data across devices, partial data, dirty data, etc. It all creates a lot of challenges. And of course, everybody says AI, yeah, AI is going to fix everything. It's the magic word, but there's a lot of things that AI doesn't do right out of the box. So one of the things, for instance, is AI should be knowledgeable of the medical context, not knowledgeable of the clinical context. So, for instance, doctors use specific acronyms for different drugs, but they can use a specific class for drugs. So AI should know that one certain drug is in the same class. For instance, they use ABX for to use antibiotics. Others use antibiotic, the word full. Oh, different other acronyms. So AI should know this all means the same thing. Also, understanding medical context of unstructured data is really important. For instance, a lot of data is still being scanned out of paper documents. And when you scan a paper document, AI should know the clinical context of that document. It's really hard. You should train a model for that specifically. And then, okay, once you have that context, and in certain ways you start talking with, for instance, text-to-speech or speech-to-text instances. If a patient says, for instance, I'm not taking insulin, AI should know that the context here is diabetes. Yeah, it's nothing to do with yes or no. No, it has to do with diabetes, and AI should show clinical understanding. Those, of course, are all our challenges that AI has struggled with. And therefore, we have a specific tool that's called MedGemma. MedGemma is a collection of open models, which is specifically trained on medical text and image comprehension. So we can use multimodal information, being from CT scans, radiology, MRIs, but also echoes, audio files, cassette tapes spoken in by doctors, and normal text as well. But all multimodal, but in a fully clinical context. And that creates a lot of potential. So we have all the data. it creates huge potential. So the transformation is impacting the healthcare industry very hard, and it creates a lot of opportunities for patients, clinicians, and also employees, of course. So the way how we discover health information, it will change the way we engage with patients as clinicians and how we manage and use the data. So the potential is huge. Everything is changing, and because of the enormous subset of clinical data, the gains can be really impressive. Also, medical data is perceived as one of the most clean data out there because it has such strict requirements before a device can give data. There has to be strict rules. There's rules by the FDA and the European Food and Drug Administration. So it's really clean, correct data. So that increases the potential even more. But okay, how do we get there? That's of course, everything begins with a unified data foundation. So you cannot achieve the AI-driven healthcare when all your data is locked into hundreds of different systems. And it doesn't depend if you're a small hospital or an underfunded hospital or a really rich hospital and really big. No, they all have the same problem. It's all different silos. So the first step is to bring all the data together and harmonize it into a standard data model. And here, of course, FHIR is the most used model, but we can also use HL7 or other data models. It depends on the flavor of the customer. But it will create one single record for every patient. Then the second step, of course, is once the data is unified, how do we alleviate the administrative burdens that currently drain the resources from our staff? So this means automating manual and repetitive workflows and give access to doctors on an easy way. Now we have doctors, for instance, before a patient comes in, he has to access so many different data stores to get one single view of that doctor, of that patient. And then it goes to the nurses or the healthcare beyond, so your general practitioner, for instance, he has to do the same. He has to gather all that information. So we need to free customers from all that, doctors from all that burden, so they can focus on high value work and be next to the patients even more. And the third step is, of course, empowerment. The modern platform, you can provide your workforce with better tools. That means AI-powered search, where they can find information buried in a patient chart in seconds. It means conversational dashboards, for instance. In an OR, doctor cannot access keyboards, for instance. He can use speech to have analytics, conversational analytics with his data and get specific data and make data-driven decisions. An example here is, for instance, there are ER doctors. When they get a patient in from a nursing home, the patient is 80 years old, she cannot talk very well. They ask the nursing home, can you send her medical history? Of course they will. They send over a PDF with 120 pages. So that means the ER doctor has to read through 120 patients to find anything that can help him for the current problem that she's having. Here, AI can immediately scan through this, and the doctor can ask specific questions without reading through the 120 page document. Those are little examples that can make a huge difference in time and in workforce for the doctors. And then once you are beyond that, the final stage, of course, is innovation. So with a mature AI foundation, you can go beyond optimizing existing operations and start innovating. And we already see certain hospitals moving towards that way. It means accelerating clinical research, doing easier research, building AI-powered tools, and maybe even developing next generation health applications. So it only enables the physicians and administrations to go beyond the standard break fix what they're doing at the moment, but even go into supporting other health sources within the society. And that's it. Questions?
So we're going to save questions for the end, if that's okay.
Okay, no problem.
And we're going to go straight into the demo to show exactly what you just mentioned, how we can automate some of these processes, and how we can show how this works in healthcare. So I'm going to just go to the next slide, which should just say demo. Perfect. And look at this. A live webinar is always going to give me problems. My mouse just ran out of battery, so I'm going to try and tether this out a little bit and see how we go. Good. Let me share Agentspace. So give me 2 seconds. Just while I'm sharing my screen and getting things ready, thumbs up if you've used or heard of Agentspace before, or even seen it before. Thumbs up. The Devo teams don't count. I'm watching you, Devo teamers, putting your thumbs up. Okay, good. So you're going to get some interesting insights here on how we can use AI and Agentspace. Just a little bit of a tour if we go into depth here. So this is the Agentspace UI. This service is separate to anything else. So if you have Google Workspace, it won't be embedded with Google Workspace at all. It's a self-hosted in GCP service, which means that you can manage where that sits, where the data sits, but also it means that you can secure the connections to your third-party services. So really importantly, the biggest difference here with Agentspace is the connectivity, which is what Jan was saying earlier. Being able to funnel in all of your data from different sources into Agentspace. So if I click here, you'll see the data sources that we've got here in our demo environment. It is the different services, like we've got Google Calendar. Confluence is our internal wiki, for example, the Devo team website. So if you've got a healthcare website with what services you provide, you can put that in as a connector. Mail, Jira, people. So all of these are going to be what AI grounds, like what Agentspace grounds itself with in terms of its information when you ask a question. So this is the default prompting box. There's actually 2.5 areas of Agentspace. So the main area here is where we can use those direct connectors to ask questions, generate content, summarize content, search for content in here. We also have a section called agents, which I'm going to go into more detail later, where we've got agents that are out-of-the-box agents provided by Google, which are really useful. I'll show you deep research in just a few minutes. Then we've got, I'm going to skip the middle one, then we've got your agents. Thumbs up if you've ever used Google Gems. Anyone used a gem before in Gemini? Yep, so it's a very similar concept, except you'll be able to ground your gem with the data from Confluence, the data from your mailbox, the data from any connectors, so SharePoint, Outlook, and you can use the data from those connectors to make a gem, to make your process much smoother. We'll show you how to do that soon in a second. Good. So for this scenario, what I'm going to do is I am going to propose that we are in a company called Atlas Care. It is a fictitious company. If there is a company called Atlas Care out there, it's just a coincidence. I made that name up last night. Atlas Care is a care company that does care for elderly. And what I'm going to do is I'm a new staff member and I have to care for people, elderly people going forward. But with that said, I don't actually have much background and I don't have any assigned carers yet. So I just got an email on my first day. So I got a message from my new manager and it said, actually, you know what? Although you don't have anyone you're caring for on your first day, could you please fill in for another carer who's sick? Can you please take care of Suzanne Smith and Bob Jones? No context given, just 2 names. I said, okay, well, I'm nervous. I've not looked at the content of how I should be doing this care or for Atlas and who they are. So I can actually start here. Now I'm going to, before I even enter a prompt, I'm going to show you something, which is this. This is our internal wiki. You should see a Confluence page. So that's our Confluence page, that's Atlas Care. How, our key goals at Atlas Care, what the differences are between our care and others. So our way of working is in here. But I've also got, let me just open the side panel here. I've also got our standard operating procedures here. I haven't had time to look through this morning. It's all here in the Confluence. I should have read it, but it's my first day. So instead of doing trolling through all of that and then looking for the care plan for Suzanne and Bob, I'm actually just going to type, and apologies, I'm using my clipboard because I'm not very good at spelling, so I don't want to do any typos. But in here, hi, I'm new to Atlas Care. I got unlucky on my first shift. I need to cover for colleagues that have got sick, a colleague that's got sick, who usually cares for Suzanne Smith and Bob Jones. Can you help me understand the best approach for each of these people? I want you to note here, I have not told it where to find the care plan, what the grounding is in terms of how to care for them, none of that. So what we're going to do is I'm going to hit go. And while it's doing that, I have to give everyone a big caveat. AI is fun to demo because it's never predictable. What I might have tried earlier might be totally different today. So bear with me. If something comes out that I'm not expecting, I'll try again. But that's just the nature of AI. Data changes in the background, and the AI models learn on different bits of information. So let's see what happens. You can see here it's already found the operating procedure. It's found the two people I'm caring for. You can see the thinking process. It's carefully reviewed the operational process. There we go. Let me just make this up. I think this is a bit too big. Let me just make this. Ooh, that's too small. There we go. There we go. All right, whoops, that's too small. So you should see, there we go, look at this. We've got the general Atlas care procedures. I told it was my first day. So it actually came back and said, well, it's your first day. You're going to need to know how Atlas operates. And so it's given me the medical engagement procedure. I deliberately made this a bit weird. But now what I did was I added that Atlas loves rooibos tea. And every single one of its patients must put a rooibos tea bag on their head while we're administering medication. Do not do this. This is not, no medical advice is given in this webinar, please. My point here, the reason I've done this is because I want to prove to you, it's not just found something on the web. It's not got content from its learning model. It's grounded in the information that we've put into this tool. For example, here, you'll see this information about the rooibos comfort protocol is actually from the page I just showed you in Confluence. It's showing you it's grounded from that. So mind, body, tea, philosophy. This is not a good idea, by the way, although AI makes it sound like one. So on top of that tea philosophy, you can see here it's got the care plan for Suzanne Smith and it tells me what time I should visit her, the morning routine. It's just given it to me really nicely. The same thing with Bob Jones, which is excellent. Now, I noticed that the times overlap a little bit in terms of what I need to do to visit. So what I'm going to do is I'm going to ask AI to help me a little bit with my visit. So here's another prompt, which is I want AI to help me understand when I can get to Suzanne, finish up quickly so I can go to Bob because the times overlap. And if there's anything I can prepare beforehand. So I intend to visit Suzanne first, then Bob. And I'll visit at 7:30 and then head over to Bob as soon as possible to care for him. Can you suggest any prep that I can do one day before, because I'm actually in the vicinity the day before, that will help a more efficient visit, so I can just go from one to the other really quickly. Now, this is being a bit more proactive. Maybe I've got a bit of time to do that. And actually, I can do that because it's going to look through their medical records, the setup, what they normally do. And it's going to say, well, actually, she has tea every morning. Why don't you set up the tea, the teapot, the tea ready to go before you enter the next day? So it should go through that checklist and give me some recommendations. There we go. So it's even giving me a checklist. I didn't ask for one. So it's giving me the day before checklist. So go in, get the location recon, make sure that you know where everything is. Assemble your care kit, prepare your bag with 2 rooibos tea bags. Okay, that's good. I didn't know to do that. Get your breakfast stock check. Make sure that Suzanne has everything where she's staying for breakfast. Bring a jar opener. It's gone a bit extra here. Okay, I can open jars. I didn't need a jar opener. So it's gone through all of that and then giving you a morning efficient game plan. I like the name of that, of what to do to make sure that's very efficient. I do like that a lot. So I do want to make sure, let's just take a look. I'm going to skip this next bit actually because it's just more of the same. So so I'm ready for tomorrow. I'm so ready. There's no issue. So I'm just going to go and check what I need to do. So with Agentspace, I might just think, you know what? I haven't checked my mailbox. It's quite full. It's my first day. I've got loads of general onboarding and everything else. Maybe I should just check if there's anything I should do, that might be urgent. So from here, I can say, are there any emails for urgent tasks or care? Let's just do that, or care that I should consider. So I'm asking it to check my emails, basically. So I'm saying, well, is there any emails that I really need to look at urgently that I should consider for care? So it's using in this case, it's the Gmail connector. It could be the Outlook connector. It can be any of the connectors you have in Agentspace. It's going to go check my mailbox. It's going to review what's in my mailbox. Hopefully, that email I sent just this morning to myself should come out. Hopefully, it doesn't come up with all the other stuff. Okay, it didn't come up with the email I was looking for, which is the nature of AI, I suppose. I did send myself an email, an urgent email for urgent care for Julia. So, all right, that bit. Normally, I'd be able to flag out any emails from my mailbox. It didn't work just now, but I got a request from my manager urgently. I need to take on one more person, Julia, and all he does is picks up the phone and says, "I don't have time to explain. You need to care for Julia." There's no medical records on the system, but there should be one in the office. So I'm thinking, well, okay, there must be a written one if it's in the office. So I go to the office and I take a quick picture. So I can attach the file. If it's not already in the system, in the connectors, I can upload a file. And then that uploaded file, I can just put in here. This one, yes, it is. Open that up, yeah. So I've taken a photo, because you can access this from your mobile. And I've uploaded the photo into Agentspace here. And then let me just give it some context. I'm going to copy it, actually. I'm going to say, you know what? I've got a care plan here. I'll show you it in just a second. I'm new to Atlas. I got unlucky on my first shift, and I need to cover a colleague that got sick, who's usually cares for Julia. I've uploaded a photo of a care plan. Can you provide it to me in English? So let's do that. And while it's processing, I'll show you that picture. If I click that, you will see this is a handwritten care note I've taken a photo of. This is a care plan. So not all data is in your systems. It might be as a photo. So I took a picture of it. And then it's going to process that image. It's going to read it. Oh, but more importantly, can anyone, it says at the top. So it's in Spanish. I don't read Spanish as this carer. And so actually, I'm not going to be able to help this person. So I think I'm in a bit of a pickle here. The notes are in Spanish. How do I do this? Well, Agentspace has picked up that it's in Spanish, and it's provided all of the information in English. And then actually, I've just realized she only speaks Spanish. So how am I going to do this? So I have to care for Julia, but she only speaks Spanish. Right. I think we're going to need a bit of an issue here. So let's have a look. I'm gonna go a little bit dark. I'm really sorry here, but I'm gonna explain and give some more context. So I'm gonna ask Agentspace. This is great. I don't speak Spanish, so she doesn't speak English, and I don't speak Spanish. Can you provide a timeline of medication I need to prescribe to her, and a written phonetic Spanish sentence that I can say before and after administering medication? Also include a greeting, explain why I'm here today. Her original carer got run over by a bus this morning, so I need to take care of them. So this is a bit of a long stretch, but hey, I'm okay to try this. So I'm going to get some interesting feedback, I hope, with how I can greet this Spanish patient in a different language, and hopefully give her care without any issues. Now, I put phonetically. I didn't realize how phonetically it's written, so I had a bit of a giggle when I tried this yesterday. So we've got the morning administration of medication, and here you'll see it's done it for me. Here's your guide for key interactions, and you're going to say in Spanish, Hola, Julia, me llamo, and then you can say your name, but it's also given it to me in case I don't know how to pronounce the words in phonetics. So I don't know if I can read that out loud, but you can give it a go if you like. Oh, lali. Yeah, I can't do that. Anyway, you see where I'm coming from, which is just an extra addition. I didn't think AI was going to be very good at, but actually turns out it does do it quite well. So now I've literally got the 2 carers that I've got scheduled for to take over, and an urgent carer which doesn't speak English, but I've got exactly what I need to do, as much as I possibly can, even though I don't speak the same language, from a handwritten care note. So it was scanned from a phone and then read. I think I'm in a pretty good state for my first day. I also think I've had a wild first day, let's be honest. One last bit I'm going to show you here on the Agentspace prompting is the connectivity. So now that I've done all this, I need to make sure that the rest of the team is aware. So what I'm going to do is I'm going to say, well, I know that our ticketing and managing system is in Jira. So I'm going to ask Agentspace to please create a Jira issue explaining that I'll take care, I'll take Julia's care today while the carer is out and place it into the CSS board, the care board. So notice I haven't told it like connectivity. I haven't told it my name. It needs a lot of context here. So it's taking the context and it's going to create a Jira issue so that others that are doing care can see that I've done this in the boards. So there we go. It's actually done that. It's given it a title, covering care for Julia today. It's put it in the right board. It's got my right email address, the task, and the priority. And I can just hit go. I haven't left this interface. And then I'm going to do one more. I'm going to say, well, Kieran's my manager. And I'm going to say, well, you know what? I'm going to update Kieran and just to let him know, you know what? I can do this. I can definitely do this. I've got all the information from Agentspace. So I'm going to email Kieran. Notice I haven't put the email address or the full name. Email Kieran that everything is under control. I'm going to communicate with Julia and administer her medication today. So what's going to happen there is it will draft and it will look up Kieran's email address. So it's looking up the people connector. Yep, there you go. It's found his full name, Kieran Gallagher. It's getting the email. Then it's going to get the context from the history of the conversation I've just had. And then it's going to draft that full email for me. I do not have to do anything there. There you go. Reviewed it. I feel I have everything under control. I'll focus on communicating with her in Spanish and administrating her medication. I did not type any of that. Okay, so I can hit send. Kieran, you're going to get a mailbox full of emails this week, unfortunately, from my demos. And that email has been sent to Kieran. And I'm just going to go and get my hands dirty and start taking care of people. Like that was literally a few minutes. And we've got a lot of information that we've siphoned through, and I didn't have to read pages of info. So this is the out of the box experience. This is what we talk, we say, you put your connectors together into Agentspace. This is how the out of the box experience feels, but we can go a step further. We can go 2 steps further. So one step further is to use an agent. So if we go in here, we see we've got agents, and I might want to use deep research. Now, thumbs up if you've ever used deep research in AI in general, Gemini. Okay, good. Well, not many of you. I would have liked to see more. Deep research is fantastic. I use it when I'm in the supermarket, and I don't know. I saw a trampoline the other day, and I thought, oh, is that really the cheapest I can buy that trampoline for? So I did a quick deep research, and it looked at all the places that sell trampolines in my area and gave me the prices. Deep research is fantastic. I definitely recommend using it in your day-to-day. But in this context, our research can be grounded into all the connectors, the Confluence, the SharePoint, the OneDrive. It can use all of that data to do deep research. So in here, I can say, I am caring for Suzanne and Bob today. Can you provide a report on everything? Oops. Should know. Now you can see my typos there. I'm not going to hit send on this, but it would actually understand that anyway. Now the deep research would take a while, by the way, so I'm not going to do a live demo. That would you go away, maybe 10 minutes later, you'll get a deep research. So here's a very blue Peter of me. Here's one I did earlier. So I open this up, and you'll see I did do the same kind of approach. Can you provide me all the details and the method or approach for care for Susan and Bob? Notice I didn't do the second names, by the way. So it's going to go ahead and say, okay, I'm going to find care plans for Susan and Bob. Make sure you go to the standards of Atlas Care. And then what it's going to do here, and I like this, it's very agentic. it's going to take a step-by-step approach on what it needs to find. And according to the information it got from the last prompt, it's going to take that information and then do search for the next part. So it's very agentic in terms of reactivity, multi-agent, that kind of thing. So you've got different agents looking for different things, maybe connected to the public web, things like that can be decided if it's needed. Someone's got type 2 diabetes because of their diet control, so it's made that assumption in there, which is great. And then it's created a final report. And I can actually read this and take a look at this and say, oh, I can see the sources. So this one's Suzanne's care plan. You can see that from Drive. You've got the operating procedures, which is coming from Confluence. So you've got all of that information, but it gets better. I'm about to get in the car and I'm about to start driving to where I'm going to care for them. But you know what? I want to listen to this. I don't want to read this whole thing. So while I'm in the car driving.
Hey, so you're covering my shift for Suzanne and Bob tomorrow? Let me give you the rundown. The most important thing to know right off the bat is that they are 2 separate visits. They live in different towns, so you'll be going to Suzanne's house first and then to Bob's.
Imagine that. Now I'm literally absorbing all the things I need to know while I'm en route. So there's no time wasted sitting behind a computer or on a phone trying to understand what my next steps are. So that's using a simple deep research agent. Going forward, we can make what's called a custom agent. So I'm on the last section, and I promise I won't take too long on this. I see Kais getting nervous about his bit coming up soon, so I'm going to try and speed this up a little bit. And we're going to get a bit creative. I'm going to get some feedback from you guys as well, which would be great. So what I'm going to do is I'm going to create an agent. I'm going to go in here and create an agent. I'm going to make this smaller so we can see. Now, we're going to give this agent a name. Now, I'm going to call this the care cover agent. So good. And then your goal here is to ensure anyone. Oh, I can't type this. This is why I paste them. I've told you this is why I paste them. Ensure anyone taking cover for care of a patient is everything there. Okay. Really, it's just really basic here, and definitely a lot of typos. I apologize. Right. So in here, I think the vital information I'm going to need is I need to describe its goal. So what is the main goal of this agent? What is your task as an agent? I'm going to paste this one. I'm sorry. Your main goal is to look for or read any submitted care plans you provide with the following information. So what information do we need from the care plan to be as efficient as possible? I think an executive summary, a high-level summary. So let's make sure that's in there. So a high-level summary of the details that we're going to ask for. So I think a critical information for providing a care plan. So basically call out anything that's really important, like a drug has to be administered at exactly an hour or on the hour because it's time critical, or they have dementia and they won't remember you, or they get physical, anything like that, I'm going to need to know. And then I think if there's multiple care plans that I give this agent, so maybe I'm doing more than one, maybe I give this agent more than one care plan, then I need it to break down that care plan and give me a timeline to service and medicate those people. And then if there's a handwritten note, make sure that it calls out anything that it couldn't understand in the handwritten notes. We know that in healthcare, in Britain, we call it chicken scratch. When the notes are written very quickly or handwritten, sometimes they are illegible. So I want the agent to make sure it calls out that it couldn't understand anything. And then the last piece I'm going to say is, if there's any care plan in languages that are not English, translate them, providing information. So I'm going to give it all that. I'm going to hit the help me write button. So this is a bit cyclical. It's AI and AI. So we're using AI to help us redraft those instructions better. There we go. See, it's got the instructions rewritten, which is really nice. It's much more detailed than I gave it as well. And then we're going to talk about the sources. Now, you don't have to say all sources. Sometimes too many sources can give you, the incorrect data. So in this case, I'm definitely going to say, well, Jira, because we're going to do tickets to Jira. I want it to send emails for sure. And I want the data sources to be from my mailbox, from Google Drive, from Confluence, from the people connected to look up people. I think that's good. I don't think we need much more. You could do calendar, see when you're doing your next healthcare visit. And you can do a start prompt. You could say, you could say, are there any emails asking me to care for anyone? So you could say, actually, as soon as you open this agent, the first thing it's going to do is look for through your mails and take a look to see if there's anyone that you have been requested to take care of by email, which is quite a nice starting point, if I'm honest. I'm going to hit save. Let's go. Let's do this. Start chatting with my new agent. Now this agent has access to the data it needs, and I'm going to say, is there any emails about Julia? And then we're going to go with that. So the agent's now going to go look at my mailbox, hopefully. Again, this is a live demo. It doesn't always work. Hopefully there's no other Julias I have emails about. It's always a risk. Okay. Yes, I found a few emails about Julia. So there you go, see? And it didn't find the care plan because it's not in the system. So I'm going to upload a written care plan like I did before. Good. And then hopefully that should spit out everything I need without lots of prompts. There we go. So now because I've done this as an agent, all the process we did earlier should be automatically done. Fingers crossed. Live demo. The demo gods are with us, I hope, as they say. Although I think that's always a jinx when you say that. And then, guys, I promise I'm moving over to you now in just a sec. This is my last bit of my demo. Good. There we go. It's done it. It's taken the handwritten care plan. It's given me an executive summary of this patient, all of the critical things, critical warning, bleeding risk, watch out. There we go. I wouldn't have known that. And it tells you the Spanish that it got that from. It's also given me an eligibility check. It says there is a word I couldn't quite understand. Perfect. This is what I mean. This is exactly how you can speed up that process dramatically quickly. Good. I hope that was interesting for you guys in terms of what the capability of Agentspace and AI would be for healthcare. I'm going to switch back to the slides. Great. We'll have some questions and answers at the end, but I'm going to hand over to Kais just now.
Thank you. All right. So we have seen what Agentspace can do out of the box. We've heard that word, out of the box, these words. So it's really nice indeed that you can quickly set up without too much, well, without any code really, to access your data. Now, what's the next step? Maybe not the next step, but an alternative approach if you need a little bit more freedom into what you want to do. And that's where you have to look at a few criteria, let's say, to know what your use case requires really. As we've seen, left side is really for Agentspace, so out-of-the-box connectors. When is it necessary? You're trying to find information. Really, what Pablo was showing is exactly what this is about. I don't know. I'm new. I don't know where the information is. I'm just going to ask natural language questions, and I should get the answers I'm looking for. Great. You have a few systems that are supported. Of course, there is a specific list of out-of-box connectors that exist. Not every possible system is part of it, but if it is part of that list, then that's probably the way to go. That's the easiest. It's set up honestly in a matter of minutes/hours, worst case. And also, something that's really nice is the ACL, so access control list. That basically is what tells the system what you as an individual can access, right? You, of course, don't want to be able to access someone else's private data or some data from the HR system, which might be integrated in Agentspace. And that is all right. That is also taken into account by default by the out-of-the-box connectors. You don't have to worry about it. It's not even like it will redact the information from the text generation. It will just not even look at it, because with the license, it knows who you are, so it knows what to look for before generating an answer, before grounding the answer. And so the main purpose here is really to to avoid having to go through different systems and have a central pane of glass where you can look at every possible data that you want to research. Now, what if you want to perform some more custom actions, some custom workflows, some automated tasks, really? We have seen with the last bit of Pablo's demo that you can indeed create a no-code agent to automate a few tasks. It remains a little bit sequential, if you can say that like this. You have a set of steps that you need to follow, but it's still leveraging the discoverable knowledge base that you have at hand. Now, ADK, so Agent Development Kit, is basically what you will use. It's a framework to, well, develop whatever you need to do for your use case. It's pretty broad. We'll go into a bit more details later on. But the idea is that if you have some advanced logic that you need to have running, and also if you don't have the need for a custom, an end user facing application, you don't need a chatbot, then it's perfectly fine. Note that if you do need a chatbot interface, you can also bring that ADK agent into Agentspace later on. So these two are not completely separated. You can connect both approaches together. Now, let's imagine I'm going to talk about another use case. I think I know, based on my own experience and also what I've heard around me, that the bed turnover process is quite complicated sometimes. I mean, people can also be waiting for a whole day for someone to actually come in, check in with them, and officially discharge them. That can be frustrating for the patient, but it's also a hurdle for the carers that actually, well, are sometimes in need for a bed that is not ready to receive someone, and you have multiple people that could go home. And so this is basically where you can bring an agent like an ADK agent into play, because you can, well, make it proactive, because it will be able to ingest real-time data streams from all over your systems within your ecosystem, within the hospital's ecosystem, such as, for example, the patient vitals information, of course, the bed management system, and it will monitor that 24/7 in the background. So you don't even need to really worry about it, so to say, but you will, at the end of the day, get notifications if there is an action to take for you. Now, also an assumption that's pretty, I think, well, it's not really an assumption, actually. Something that touches the whole healthcare system generally when we talk about AI is there is some kind of cautiousness, sometimes even fear, into letting AI decide the actions, the plan to take, and making any kind of predictions. It's kind of a black box. We don't want that because, well, it can have really dire consequences. We're talking about people's health. So in this case, we're not saying this agent could really discharge people and so on. No. We're just saying this could be a co-pilot to facilitate the healthcare workers so that they don't need to worry too much, and they will still do their work, but they don't need to worry too much about monitoring the whole data flow themselves, but they will get notifications when a patient or a set of patients is a good candidate for discharge. And what makes a patient a good candidate for discharge isn't really up to the AI to decide. It would be based on some business rules, some, well, yeah, logic that is defined by the healthcare experts themselves. So we're not talking about replacing the healthcare workers. We're not talking about uploading some information into some systems without being warned of it. No, we're just talking about being able to notify people upfront so that they can be more proactive in the way they're working. So the ADK, I mentioned that a few times. What is it actually? This is really a framework for developers. So we're going back to the development approach, really, the development efforts. And what it can do is basically virtually anything, so to speak. So you can connect to any API, but not only API really. So we're talking about the tools here, which are basically blocks of code that your engineers can define. It's really anything. It can be just a mathematical operation. It can be a connection to your bed management system. It can be anything. Whatever the agent needs to have as a capability to do its job. You also have the ability to do custom logic. So as I was saying, you can really look at different data sources, try and correlate a little bit the information, derive some outcome out of it. It's not just about reading the data from different data sources, but it's also about doing a little bit more intelligent-based operations. And finally, actions. As we've seen with Pablo's demo, you can already send out emails, update, or create tickets in Jira, for example. But we're talking about, again, more freedom in the types of actions that you want to do. So it could indeed be sending out an email, for example. And in this case, you could leverage the out-of-the-box offering from Agentspace. There's no need to reinvent the wheel. But it can also be, I don't know, for example, updating your custom system that is not not custom, but the bed management system that is not part of the out-of-the-box offering from Google. Well, you just need to develop that. And what's really nice when it comes to actions or tools specifically is it's really a small piece of code that you can reuse. So you could think even of having your library. First time you have to develop an agent using that, yes, it will take some time. But you can think of reusing those tools later on. It's really, the goal here is to make this kind of agent as modular as possible, so that later on you can reuse what you have built before. You don't need to reinvent old connections for each separate use case. So basically, I try to explain how we can take this to the next step by having a more proactive approach. But what does it do from a process perspective, really? I think we can divide that into these 4 steps that we see here. So the monitoring is the first step, right? It's just looking at the data. I think you got that at this point. So you can think of it as an EHR reader, so the electronic health records, right? That would constantly scan patient charts, vital signs in the background, looking for any kind of positive recovery pattern that indicate the patient is actually getting better. And so at this stage, it's the heavy lifting of reading the data and looking at all the different sources in real time. Secondly, it needs to correlate. So that means that there is some custom logic that comes into play. You have some thresholds that are defined. This is really where the business logic is defined, where we leverage the knowledge of the healthcare workers in the definition of this agent. And so you have kind of a discharge candidate profile that you're mapping your data against. So it's really just looking for a match. It's not deciding anything yet. That is for the next step. So if you have a match, that is a good sign that the patient could go home. Then you would need to send a notification to the healthcare workers. You need to let them know there's something for you to do at this point. I'm not taking any action. I'm just letting you know you might have to perform an action yourself. And finally, it prepares anything. For example, it could be just a briefing report. You don't need just sending just a raw alert. It is quite useless, so to say. You want to also prepare the work for the workers that will have to come in and perform their own jobs. So we'll have a briefing report. You can provide some additional context, and then you can send an email or a notification on whatever communication channel you are using. So instead of just saying alert this patient, you can really have a broader understanding of the patient's disease, the evolution over time. It's really up to you to define how much information you want to provide, because you don't want to bombard, of course, the healthcare workers either. But again, this is custom, so it's really up to you to define what you want to do with it. So that is all. I see we have only 2 minutes left. So I'm quickly going to jump into the next slide, just explaining that, well, today I hope we have been able to give you a good understanding of what Agentspace can do, what generally agents can do for your business. And the next step then is for actually you to let us know if you are interested in having a discovery session with us. So what will happen after this event, this call today, is you will receive an email to ask you if you're interested in such a session, and you will have to answer. It will not be planned automatically, but if you let us know that you're answered, that you're interested, sorry, we will then plan a meeting with you so that we can come in with an Agentspace expert and a salesperson to explain a little bit how we can tackle that together and what actually makes sense for you, what's the best fit for your needs. And I will hand over to Pablo for the change management slides.
We have like 1 minute, so we didn't.
Yeah,
I wanted to get some Q&A. I'll do really fast. Let us know if you need expertise in getting Agentspace turned on and enabled. Please don't underestimate how much change is needed. So giving someone an AI tool doesn't mean they use it. We need to understand why and how and the concept of when they use it. That's really, really important. We've found a lot of products fail. I think there's actually a MIT report there if there's not the right adoption included. So let us know if you want us to show you that adoption and how we can help you take that journey. I'm going to pause for like 30 seconds left. If there's any questions, I'll stick around for an extra minute as well if needed. Is there any questions from the audience? Anyone want to ask anything? Then please do. This is a great opportunity for that. Absolute silence. Everyone is shocked by the ability of AI and wants to run away and start using it. I think that's what I'm getting from the silence. Okay. Yeah. Well, we're on the dot. If there's no questions, I'll give you another like few seconds to finish writing a question if you've got it in the chat. But otherwise, if there's no questions, it's really nice of all of you to join. Really appreciate this. It's during the workday, so I really appreciate all of your time. It's been fantastic having you on here. Hopefully, it was interesting. You'll get the recording. And thank you very much, Jan from Google and the Dev teamers for all the effort and the time spent. Really, really do appreciate it. So do reach out if there's any questions.